Getting a job in Ireland has not been very popular as it used to be. And I believe that while we are going through this job hunt, it's equally important for us to also prepare ourselves for that interview. So, as part of my new project, which is actually going to cover popular interview questions for various divisions, today we are going to have Mavis from Galway University Hospital, who is actually going to take us through some various or popular interview questions for our midwives. Yes, we are actually starting with the midwives today. So, remember to stay tuned and go nowhere. Hi, my sister Mavis, welcome.
Hi, Ness Momo. Thanks for having me today.
Oh, I'm actually thrilled because I'm always in your DM worrying you, telling you one way or the other, I want us to do this, I want us to do this. Thank you, because you're always ready for me and I really appreciate it. Thank you.
That's up. Yeah.
Okay, guys. So just a disclaimer: we are not saying that these questions are questions that will definitely come, during your interview, but we are saying that they are popular questions, and we are not just going to tell you that answer it this way or that way. But we are just saying that maybe during answering of those interview questions, make sure that you have these details in place. Yeah. So I'm just going to move straight to Mavis right now, so she takes over. Mavis, the floor is yours.
Okay. Thanks for having me. It's a privilege and an honor to be on this big platform. Interviews are meant to help you secure a job.
Yeah.
And it's the most crucial aspect of the whole process. Yeah. Of course, you can't go through everything and then you fail the interview. It's like a big deal.
Yeah.
So you need to prepare yourself mentally, knowledge-wise, and be ready for everything that comes on the panel. Like we all know, during any interview, you have to be smartly dressed, professionally. Your hair, your makeup, just to make sure that you are in good shape.
Yeah.
And then you have to give your best of attitude, like smile, be confident enough, and try as much as possible to show your interest in the interview. Some people get into the interview point and they seem like they are off the whole thing. They don't seem to be part of the whole process. Just build that confidence and build that attitude that you are ready for the job.
Yeah. Yeah.
And these are the few steps that I would say just before you prepare.
Yeah.
And knowledge-wise, most interviews are based on your CVs or your application form. So in Ireland, it's usually the application form that they look at, not, I don't know of the nursing homes and the private hospital, but in the HSC, it's usually the application form. Yeah. And in the application form, you deal with it's it's a CV, but it's quite comprehensive.
Yeah.
So you have to build your knowledge on that. You have to know what you wrote and be ready to answer the questions that they ask you based on the stuff that you put in the application form.
Yeah.
That is very important. And then again, you also have to understand some basics of the role that you are going to acquire.
Yeah.
Or you are being interviewed for. So you should understand what it is. Because if I'm a midwife, so in terms of midwifery, if you are being assessed or interviewed for the role as an antenatal midwife, definitely you have to go deeper into what antenatal care is in Ireland and know what it is. Yeah, so you don't just come in and say, I'm a midwife. You have to be prepared based on the area of your job. Very important. And being said that, in the application form, usually there are 3 sections in the form. They have the planning organization skills. You can't remember what usually is a scenario. They ask you a scenario and then you give them means as which you would acquire that skill.
Yeah.
So those 3 basic skills, you have to prepare some scenarios.
Yeah.
It might be the same as you wrote in your application form, or you can have loads just to help you build your points. Okay. Yeah. So the first usually is the planning organization. So they can ask you questions like, how will you plan a ward? For instance, you come on a ward, you come on a shift, and you have less staff.
Yeah.
Or the skill mix is you have less experienced staff, but you have quite demanding patients that need some form of experience. How are you going to blend your staff strength and then your clients or your patients?
Yeah.
So those kind of areas. So you think around it. How do you plan? How do you plan your day? How do you plan your week? How do you plan your month? They might ask you based on your years of experience.
Yeah.
And like I said, your application form, what you put in. So for instance, you said in your application that you were a ward manager at some point in your career. they might ask you how you managed the ward, and then they create a scenario and then you answer them.
Yeah.
Okay. And then again, the second point or the second skill usually is around building and maintaining relationships. Basically about how you relate with your patients, their relatives, your other multidisciplinary team members and stuff like that.
Yeah.
So in that regard also, they can ask you if, for instance, you have a confrontation with a staff or a patient, how do you deal with them? Okay, how do you react in issues where it has to do with you and other people? Or sometimes it's not even you. I remember in my case, they asked me if I see two colleagues of mine arguing or not in good terms, and if they are on the ward caring for patients, obviously we can't come to the working environment with that kind of, so they usually ask you questions based on those areas as well. And the last on the application form I remember is how to commit to providing quality services or care. So in that regard, it also has to do with safety, infection prevention and control and stuff like that. Okay, so you think around those things and have scenarios. And one other thing that helps in all this is that you try and answer the questions based on your achievement. We've done a lot in our practice. There are lots of things that we've done the year of care to people, wherever you are working, either in Ghana or Nigeria or wherever you are working from. And sometimes what I've come to appreciate is that they sometimes want to have that feel of what you did personally, but not like the book or the theory kind of stuff. So for instance, if it is building a relationship, usually you can cite the example, create a scenario. If you have one, if you don't, there's so many scenarios that you can create. It can be that you had that experience yourself. It could be you witnessed that experience. And then as you answer, then you go ahead and tell them the outcome of that situation. So for instance, if it is about planning an organization and they ask you, so you come to the ward and you are short-staffed, but you have huge number of patients, and some of them, they need like down to one care, whatever care they need. And then you go ahead and say, okay, fine, back in my country years ago, this day, there was this day, I did this, and in the end, this was the outcome. Whether it was good or it was bad. It's not really about it being on the positive side. It could be that your experience ended in a negative side, but then the reflection that happened after us, then you kind of explain to them that because of that, you have gained that skill in your planning and your organization skills. So that kind of way. So usually it's very good that you create scenario. If they ask you the question, reflect, take a moment, reflect. Answer is based on your experience and then your achievements out of that. Okay, it's very key, so that you don't have like two size fits all kind of answering. So it's very diverse, because we've seen and we've come across all these things during our practice. It's very common with us, just we've not really had time to go through or reflect to know what happened. So it's very important that as you talk to them, it's like you are presenting yourself. They don't know you much. They are taking you for the role based on the presentation that you give them. So it's sometimes people have like the best of CV or application form ever, but in the time of the interview, they feel it's all based on confidence, and it's all based on how you sell your ideas or yourself to them. It's very key. Very, very, very important. And then one thing also is that in all this, you try and state that you would also do them according to the hospital policies and protocols. You can't solve a situation in Ghana same as you would here, because even in Ghana, we have like different organizations with different policies. So you just let them know that you won't do it based on what you did there, but you have the skill, you have the knowledge, and your willingness to practice is based on their policies and their procedures. It's one of the surest way for them to know that you are really going to practice safety. And again, you should know your hospital you are going to work with, their policies, their interests, and let them know that even in answering some questions, you can cite, for instance, I came across, I think during my interview, during my search in the hospital, I came across a part where during, I think the part of the year, they have a day set for commemorating neonatal deaths kind of thing.
Yeah.
So probably if they ask you a question based on that, you can say that, yeah, I know that in your hospital you do this, and I'm happy to be part. I also have some ideas to bring on board on that day, stuff like that. So it's good. Then they know that you have interest in them, in their hospital, and you are willing to work with them. Okay, so you should also let them know that you have some knowledge in their hospital, their protocols, their achievements. So you can't be hitting on them as you go on answering their questions. Very, very key. There are some domains that the Nurse and Midwifery Board of Ireland work with. There are 5. So usually in answering your questions, you try and mold it around that area. So in the domains, there are 5, like I mentioned. It has to be professional. Your clinical decisions and practice has to be top notch. You should let them know that you know what you are saying or what you are doing. And then knowledge-wise, you should really prepare based on the role, like I said. So for instance, if you are going into the midwifery interview, of course, the basic is antenatal care, intrapartum or labor care, and then postnatal care. These are the 3 basic areas that we practice as midwives. So antenatally, you know what you do in your home country, but what is done here, then you find out from them. And then you kind of read more, get more insight about them, and then you tell them. And one thing again is that you let them know what you know best, and you frankly appreciate what you don't know.
Yes.
So if they ask you a question like, for instance, on CTG, most countries don't use it, okay, especially in Africa. And even those of us that used it before, it wasn't used properly as it is here. Most of them were used by the doctors back home, but the midwives were it was usually for the high-risk patients that was left to be cared by the doctors. And so if you come here and they ask you, or during your interview, they ask you anything about CTG, of course, you can't say you don't know anything about it. You know it is part of their means of caring for patients, monitoring the overall health of the baby. So you should have some understanding to the CTG. But if they ask you something very technical and you are not sure or confident, just simply tell them that you don't know that. But you are willing to learn. If they give you opportunity, you are willing to learn and practice based on their way of doing stuff. Okay. Yes.
Okay. So would you say that when it comes to the midwifery, I know that like when it comes to overseas employment, when it comes to midwives, it's mostly the HSC. And please, when we say HSC, it's the government sector. I've said this countless times on my channel. Okay, hardly have I seen any private hospital or maternity hospital in Ireland actually recruiting from overseas. So it's mainly the government hospitals. I know that they usually use the competence-based questions that you just spoke about. So would you say that most of the questions are actually based on those questions, or after assessment of the scenarios that you actually wrote, will they have like additional questions that they might ask you?
Yes, of course. So like I said, so the 3 domains that I mentioned, they can have like 3 sub questions on each domain. Okay. In terms of quality care and practice, it's usually about the obstetric emergency care. So around that area, the most common questions that they ask is your PPH, how you manage your postpartum hemorrhage, how you manage your shoulder dystocia, how you manage your eclampsia, your pre-eclampsia. So it's basically that. And like I said, we know how we do it. And it's kind of the same, but some drugs and some process are done different here. So you tell them what you know here, as in back home, how you do stuff. Tell them that, and usually it's very, very similar. So in my interview, I was asked during my care to a laboring woman, and she goes into shock. What do I do? And I know that, for shock, you have to elevate the lower body of the patient. You have to make sure that they have loose clothing, ensure that the room is airy enough, and try and start doing your observations or the vital signs like we say back home. So your eye meals, like we would say here, so your blood pressure, temperature, and stuff, you escalate the care as soon as possible or you call for help. You know, that kind of way. And it's very similar here. They were like, oh, yeah, yeah. And what else? So if they try to let you know that you are on the same, like, you have the idea, you have the skill, you have the knowledge, and probably you leave a thing or two out, sometimes they fill in the gap for you and let you know that, yes, what you said was correct, but here we have done this or that in addition to what you said. So basically, it's about your obstetric emergency cares. Those are the basic ones. Shoulder dystocia, it's about your PPH, it's about your sepsis, it's about your like infection, it's about your shock, it's about all those things. Okay. And when it comes to the neonatal sections too, it's basically about neonatal resuscitation.
Okay.
And your CTG. Okay. These two are the most frequently asked questions. Okay. So they want to know your knowledge on your CTG. Though they know, they appreciate that we are not confident with the CTG, but they still want to know what you do or what you understand, because you can't just come without any knowledge at all. If you are willing to be here, you know, that kind of way.
So when it comes to this CTG, I don't know how you call it. Like, what will be your advice to oversee midwives? Okay, when it comes to that topic, what should they actually look at?
All right. So with the CTG, I would encourage that first of all, we get some PDF notes or books on CTG to give you an idea. There are loads of videos on YouTube and stuff that you can go and have a look. Okay, just to prep your mind and to have a pictorial understanding of what it is. Okay.
I know you actually mentioned CTG and something.
CTG and then neonatal resuscitation. So how to resuscitate the baby after delivery. It's one of the key things that we do, because quality service wise, based on that skill that is given to every midwife, and like go through a lot of rehearsal scenarios almost every time for all staff on duty, every day, anytime. And because of that, things have been zero neonatal death, zero at best. You can't, the baby can't die. Even if you want, because of knowledge and the skills that they've given to the staff. And of course, it's not very different from what we used to do back home, just that they have more personnel, they have more upgraded personnel like the doctors, they have more resources like the machines and stuff. But the basic things that you do as a midwife is to do your bag and mask. That is what we do in Ghana. So you have to know how to breathe for the baby. So that alone is one of the skills that they expect that you know. Okay. So like I said, you let them know what you know best. Okay, and then let them know that however way you are willing to learn, and you work according to their hospital protocols and management and policy.
Okay, thank you so much. Anything else?
Yes. So basically, that it's just like I said, everything. And so the common questions again will be the obstetric emergencies. Those are the most common questions. So anything obstetric emergency, you have to go into it and know how to go about it. So like the PPH is similar, but they have other drugs that they use. But of course, you still have to do your vital signs every 5 minutes. You still have to palpate the uterus and rub and make sure it is well contracted. You still have to weigh or measure the blood loss. You still have to escalate care. That's the first thing, to get more hands. You still have to, so it's like the basic thing that we know already. So the obstetric emergency care is one of the most common questions. And then again, the other question is your interpersonal relationship. It could be if a staff is cutting corners. It could be if a staff is doing something or providing a substandard care. Those ones. It could be a staff practicing something that they don't have knowledge or confidence in doing. It could be giving wrong information to the patient and stuff like that. And then when it comes to infection prevention and control measures, those basic ones, how to prevent cross-infection and stuff like that. And then when it comes to building relationship and then communication, I forgot to mention that there are a lot of questions on communication as well. How to escalate care. And then here we use the ISBA. And so the ISBA is the tool that we use to communicate or escalate care. And so that is also what you should be looking at, your ISBA. You should also be looking at your IMUs. The IMUs is just the vital signs. They term it as IMUs. So what is there and what should be done and what should not be done. Quality-wise, like I mentioned, well, in terms of quality, is basically about working according to their standards.
Yeah.
That is the word they want to hear, that you work according to their standard. Some of the questions that can be asked are include audit. How to, or what is audit, the effect and the importance of audit. Like how we audit in Ghana, basically, we can have clinical meetings, you pull out data from the GIMS, that's the data, national data that we use in Ghana. And then you can also ask questions, verbal questions from patients. There can be debits, there can be other activities that we do, audit our care, usually evaluations, end of year meetings, clinical meetings, ward meetings, that kind of thing. And then again, obstetric emergencies that they can ask, these ones, at least you won't get less than 2 out of the obstetric emergency care. So some include cord prolapse. So how to manage cord prolapse. And then breech. If you have a breech delivery, it can be undiagnosed. So for instance, the patient came to you, it was cephalic all through, and just at the time of delivery, you realize the patient was breech, or the patient came to you and just when you examine, the patient was breech. What will you do? Okay. And then shoulder dystocia, which usually happens during delivery. Those are, it's a very common question that they ask. And then obstetric shock. So if a patient gets into shock, what do you do? And then PPH, postpartum hemorrhage, it's also one of the commonest questions because it's like the daily kind of thing that we come across almost all the time. And then they can also ask you placenta abruptio, placenta previa. They can ask you ectopic pregnancy or ectopic rupture and what you do at that point, okay? So these obstetric questions, emergency questions are asked by almost everyone. At least you not get less than 2 out of that. And then they also ask you questions on patient safety. So I mentioned that quality and safety is key. So in this sense, they can ask you questions. If your colleague or a doctor is cutting corners, what do you do? If a patient was described of overdose or underdose, or if somebody is given an expired drug, or those kind of things. So anything that puts the patient at risk is one of the key questions that they ask. And when it comes to patient observation, they also ask how you observe the patient. So you observe them with your eye, with your hands as a midwife, by palpation, and sometimes with your gut feeling, your intuition. There are some things you can't really place your hands on, but you feel within you that this should be done this way. So all those things can be done. And then the vital signs, how we call it in Ghana, but here they call it IMEMS. That's the observation for maternity care, kind of. So even with your obstetric emergency care, they might ask you how to observe the vital signs for somebody in shock, during PPA, during shoulder dystocia, during breech, and all those things. And then the last I want to add is about communication. How do you communicate? They have a tool called ISBA. We might not go into that today because of time. So ISBA is how you communicate, how you escalate, how you call for help, how you let the other team members know what is happening to the patient and what needs to be done for the patient. And then good record keeping, how to document, what to document, and then what to say and how to put it. And then your evaluation, and then just letting other multidisciplinary team members also aware of the care.
I think you've actually mentioned a lot of stuff, a lot of things, and I believe that it's actually going to be very helpful. Whilst you're talking, if you remember, that's fine. I believe it's going to be very, very helpful for our overseas midwives because of late I've had a lot of people reaching out to me. I had an interview with so and so hospital, but unfortunately I did not make it. And I think it's not really good. That actually called my attention to this project because getting a job is already very difficult. And then you get a job and then you fail an interview shouldn't be like the case at all. And I think that we've also had a lot of midwives also failing adaptation as well. The main reason why I actually did that video on adaptation, which has been very helpful to a lot of overseas nurses. So I believe that this is equally going to be very important. Of course, you might get some like general questions, which might just run for whether you're a general nurse or a psychiatric nurse or a pediatric nurse. Let's say your weakness, why we should even employ you into our system. You might get all those general questions, but why we're actually doing this video is actually to kind of narrow it down for midwives, some peculiar questions which might not be, general to all divisions. And I believe that maybe have actually done justice to this video. Maybe do you have anything you want to add up?
Okay, so just a quick one again, just to say that you have to be confident in your own practice. You don't have to feel like a different world altogether. So you need to say something that you might not even know. Just say what you know. Be confident enough. Give them the smile, like I said. If you don't know, just let them know that it's your first time ever hearing that, and you go back to review. It's one of the keys. So like I said, sometimes it's not just how you answer the questions, but it's about how frank you are with them. Okay, sometimes it's those basic things. So let them know that you appreciate it very well. You don't know, but you look into it whenever you get the chance. And sometimes you have to relax, reflect before you answer, because you rush in answering, you might make some mistakes. So you are right to say that. Can you give me a moment to reflect? I remember they asked me about planning. And I told them, actually, during my practice, sometime there was a low patronage in, is it antenatal care or something? And then I did A, B, C, D. I involved the hospital management. I involved the community members. We went on a campaign. We did some debates. We did A, B, C, D. And then because of that, this was the outcome. Okay. But just before I answered, I actually have loads of what you are asking me. But I want to give you this because this is, I had this achievement. And because of that, probably we increased from our attendance from 20%, that's just a quote, to probably like 30 or 35. And they were like, oh, okay. And like those basic things, like I said, let your achievement come out. All the things that you tell them, just tell them your achievement, your learning curve, what the results that that came out of that. And it shouldn't be like book or theory and stuff. They want it more practical. It's something I've learned from them. They want they want the practicality of what you're telling them, because they know that at the end, when you come there, you will still not practice as you practice in Ghana. But then if you know that you have that kind of mindset, you are open and you are more practical, then they know that you are going to be of use or of good instrument to their hospital.
Yes. Thank you so much, girl. Thank you so much. I can't wait. So you also start your own YouTube channel, which is just going to be based on midwifery stuff. Okay, guys. I believe that this has been very useful to our midwives. Just remember to shave it some love, okay? Encourage our lady. Give her some comments. If you have any question for her, why not just drop it in the comment section, and I'll just attention to it. She'll come and then put more stuff on it. In case if she remember anything else, she'll still come and post it under this video just to help our midwives. Thank you so much, girl. I really appreciate it.
Oh, thank you.
And just to add up, guys, I have a lot of people asking me if I could do a video on this and that. I have different videos on different topics. So just go on my channel, click on the, when you see my home screen, look for playlist. Click on the playlist. I have playlists for different topics, okay? So I'm just going to create a playlist for popular every questions and for all divisions as well, which this is actually the first one. So I know that it's actually going to help you all. Remember to like and also share this video. I'm also going to drop the link to my Telegram page under this video. If you want to join my Telegram page, you can equally join as well. And I believe that if you want any assistance, we can also help you with that. If you want me to assist you with any one-to-one coaching, yes, you can just send an email to nesnamomo1@gmail.com, and then I'll also answer to that as well. Thank you so much, girl. See you all soon on my next video. Bye.
Bye.